That's so far. We certainly expect more to be coming in later. And of those people tested, 4.4% tested positive. Now, for comparison, the previous week we were at 258 cases per day and 3.5% of people testing positive. So it's going in the wrong direction, not necessarily fast, but it's going up. Case counts are also rising right now in Delaware, New Jersey, New York, and most of the New England states. As far as deaths goes, we have 12 new deaths identified from the coronavirus, bringing us to 3,169 total since the beginning of the epidemic. Now, we're averaging 40 to 50 per week of deaths in early February. That number seems to be decreasing in later February. So I'm optimistic that is continuing to go still in the right direction. Now let me update you on where we are with vaccination. Our supply of vaccine doses continues to grow. Last week, we have allocated for delivery this week 19,890 first doses of the Pfizer vaccine, 15,600 first doses of the Moderna vaccine, and we don't know the exact number, but about 6,000 first doses of vaccine to pharmacy chains is being delivered directly by the federal government. Put those all together, that's about 41,000 total first doses arriving in the city this week. In addition to that, though, the vaccine that is coming for the vaccination clinic at the convention center is about 42,000 per week, 6,000 per day. So there's many more available through that mechanism. As far as administering the vaccine, as of Monday evening, we reported a total of 285,000 people who had received their first dose and 121,000 people who received their second dose. Of those people with their first dose, 22% were African American, 5% Hispanic, and 7% were Asian. Now, for the week ending February 28th, so a little over a week ago, the city providers combined administered 51,300 doses of vaccine. That's first and second doses combined. Last week, it ended last Sunday, so far, there's more than 90,000 doses that were administered. That's a huge jump up, not quite double, but a very, very big increase. And that's due in large part to the vaccines at the Center City Vaccination Center, but also there were increases delivered by other providers in the city. That's what's happening in the city as a whole. And just reminded that there are teams also going to the most hardest hit institutions, nursing homes, personal care homes, and assisted living facilities. Those teams have now visited 96 of those facilities at least once, 92 twice, and 45 three times. So they're getting close to having done their planned 3 visits to all of these facilities. Just to remind people who's eligible for vaccination in the city right now, it's frontline essential workers, it's people over the age of 75, and it's people with high-risk medical conditions. Then just to remind people where we are with how vaccine is being made available. We're now up to 134 different enrolled provider sites that can receive vaccine to be administered to people. That includes all the city's hospitals, 40 clinics, and 58 pharmacy sites. Now, there are large community clinics that will be taking place this week that are run by my department, the Department of Public Health. Today, we're going to be at Community Academy of Philadelphia Charter School. On Thursday, we're going to be at the University of Sciences. And then Saturday, we're going to be at the Martin Luther King Older Adult Center in North Philadelphia. And as the mayor said, that there are new clinics that will be open. Next week, the health department will be running a site at Simon Gratz High School. It's 1798 West Hunting Park, Nicetown, Tioga. That's on Monday, March 15th. Then on Wednesday, March 17th, we're going to be at the Grand Yesha Ballroom at 2308 Snyder. And on Friday, March 19th, we're going to be at the EOM Athletic Association at 144 Moore Street. Now, there are 3 additional sites that we have to bring on board. I did not put them in my talking points. I'll follow it up in a minute. I just didn't get it in front of me. But there are 3 additional sites in other neighborhoods that will be opening up the following week. In addition to those, next Tuesday through Saturday, we'll be starting the second dose clinics for people who are now 3 weeks past their first dose at the Martin Luther King Older Adult Center and Community Academy and the University of the Sciences. Now, let me talk a little bit more about the Center City Vaccination Center at the Convention Center. That operation is running extremely well, and it's hitting its targets for the number of vaccinations it's delivered. Overall, it's delivered more than 32,000 doses since it began. And in the 5 days since it's been operating full-time, it's averaging 5,908 people per day. The target was 6,000 per day, so it's very close to its target. The people who are being directed there are people from our vaccine interest form who meet the eligibility criteria of being 75 plus, having high-risk medical conditions, or being a frontline essential worker. And we're coming up with those invitations. We're oversampling people in the less vaccinated zip codes. mostly by email. Now, we have had some problems that have been seen around the country where the email invitations end up being shared and people end up being scheduled and coming in and getting vaccinated who were not invited. At the same time, people from the low vaccinated zip codes have been somewhat slower to schedule, and a smaller fraction of them have been vaccinated than we would like. So we've put in place several actions to address that. First, we are working with the software company to send out email invitations that cannot be forwarded. That's happening now, but those email invitations are going out slower, and it's slower than we would like. And so to supplement that, so that we make sure that people who are eligible are able to get in the site, we're making phone calls to high-risk people on the list, and we're directing people to the Poison Control Center, to the Philadelphia Convention Center in other ways. And we're getting help from other organizations to do that. There's phone calling taking place by city call centers, Medicaid managed care organizations are calling their members, and some community organizations, an increasing number of community organizations will be enlisted to help call some of their eligible members to direct them to the Convention Center for vaccination. So if people want to be vaccinated at any of these sites, and if they don't already know of a place where they can get vaccinated, they don't go to the convention center. Don't just show up. It's not a walk-in clinic. Go to www.phila.gov/vaccine-interest and put your name in the database. Or if you don't have internet access, call 311 and staff will put your name in the database for you. Total, we have now just over 300,000 people who have signed up in that database. Of that 300,000, almost 70,000, or 23%, we now know have been vaccinated. We know that that is an underestimate because we don't have a perfect match between our vaccinated database and this registration database. So we are gradually working our way through that database. And just to remind people that for organizations that want to sign up because they believe they have frontline essential workers that are eligible, there's a separate sign up for organizations, www.phila.gov/businessvaccine. And we have started to notify and direct some of those businesses or some of those organizations to send their employees to the Convention Center for vaccination. And just an update on our guidance. There is new CDC guidance for what vaccinated people need to do and don't need to do. And the guidance I can summarize is this: that if you are fully vaccinated, you do not need to wear masks if you're around other vaccinated people. And you don't need to wear a mask if you're around a single other household where the other people are low risk. So for example, if you're a grandparent and you're visiting your grandchildren, they're low risk, and you're vaccinated, you don't need to wear a mask when you're around them. And if you're vaccinated, you don't have to quarantine or be tested if you're exposed to COVID. But even if you're fully vaccinated, you should still avoid medium or large size in-person gatherings. So don't get together with a crowd of people, even if you're vaccinated. If you do have symptoms of COVID, you should still get tested because some people, even vaccinated, can get this infection. And if you're in public, you should still be wearing a mask. Finally, I should say this. As the mayor said, the first case of COVID was reported in Philadelphia 1 year ago tomorrow. So it's worth taking a little bit of a look back at where we've been over this past year. Overall, it's been a long, difficult year for everyone. More than 120,000 people have been known to be infected, more than 14,000 hospitalized, and more than 3,100 have died from this infection. And everyone in the city has suffered in one way or another. People have lost their jobs, people have been out of school, people have lost their loved ones, and everyone suffered from just being physically apart from the ones that we care about. And all the virus really proved to be worse than we expected when it first arrived. We initially thought the spread was going to be from people who had symptoms and was going to be spread through droplets. It's now clear that the virus is often spread by people who don't have symptoms, which makes it harder to pick up, and also it is spread through the air. Both of those make it harder to prevent the spread of this infection. But everyone in Philadelphia has adjusted and adapted to the changing understanding of our risks and the changing recommendations. People have stayed home, people have curtailed their activities, and people have worn masks. And much of that has really worked. When this epidemic first hit the city of Philadelphia, I looked at some of the numbers and came up with a rough estimate of if we did nothing, how many people might die from it. And that rough estimate was about 6,000 deaths. So the actions that we took looks like probably saved about the deaths of 3,000 people. So we've lost many people in Philadelphia, but we've also saved many people. And the vaccine now, I believe, should make a huge difference. It really is a miracle of science that we have vaccines really this early. For other diseases, it took years to develop vaccines. These vaccines are safe and they're effective, and now we're distributing them here in the city of Philadelphia. So I'm sure there'll be many more problems ahead. This is not over yet, but I'm very optimistic that each month in spring, things will get better. So after all these tough months over the last 12 months, we are finally winning. More information on all of our recommendations and data is at our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We'll now move to Q&A for members of the press, with Spanish remarks to follow at the end of this portion. In addition to Mayor Kenney and Dr. Farley, we're joined today by Managing Director Tumar Alexander and Fire Commissioner Adam Teal, who also leads our Office of Emergency Management. PIDC President Ann Bovaird-Nevins is also available for questions related to the new business relief program that we discussed, CHIRP. Because of a limited time, only one representative for each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer. We'll limit our first rounds of questions to the topic of COVID-19, including the new community vaccination sites and the CHIRP program. If you have questions regarding other topics, please hold those for a potential second round. We'll get started today with Mitch Blocker from NBC 10. Mitch, you should be able to unmute yourself and ask your questions.
Thank you. Good afternoon. Dr. Farley, do you think FEMA will be here beyond 8 weeks? And if not, how will the city handle administering the second dose shots for all of the people who got their first shot from FEMA?
All that FEMA has committed to is just the 8 weeks. And we're going to start the first 3 weeks giving the Pfizer vaccine. Then the next 3 weeks will be second doses of the Pfizer vaccine. Then the question is, what happens after that? And we are looking at whether we can have Johnson & Johnson vaccine after that, in which case we wouldn't need to deal with the second doses. That would be the best solution. We would welcome to have the federal government stay here beyond those 8 weeks.
So in a week where FEMA has basically doubled the number of vaccinations in the city of Philadelphia, that just to do that is remarkable when we've seen kind of the buildup from the health department and all the rollout. You have over 100 sites. I guess I wonder, could the city health department double its vaccination output if you had more vaccine?
Right now, the limiting factor is less the vaccine than it is all of the providers in the city. And I do think all the other providers in the city, their number of doses they deliver each week is rising, and it will continue to rise. We can get to more than where we are right now, and it'll be a loss if the federal site leaves, but we're still there's we're on a trend towards increasing number of doses per week.
So Philadelphia has now vaccinated more people than the known number of infections, and that's something that yesterday the United States crossed that threshold as well. What do you think about what that means for the trajectory of the pandemic? Having more people.
Yeah. The infection probably gives you antibody to protect against a future infection, and vaccination we know produces antibody to protect against future infection. So those two numbers, we don't know how much overlap there is between the two. The two numbers increase the number of people here who are protected from infection, and that should reduce the spread in the community. So, I've been saying for a long time that we need to get through the winter wave of this epidemic without the vaccine based on mask and distancing. I think we're close now to where we may be having enough that we're going to change the trajectory of the number of cases we have per day, and maybe even sooner start to change the trajectory of the number of deaths we have, because we're making a special point to vaccinate people who are vulnerable to die from this. So I'm hopeful that we'll start to really see the impact of that combination together soon.
But is that barrier, is that significant? I mean, is having more people vaccinated than known infections, is that a threshold that is potentially historic, a changing pivot point?
The number that really matters is are getting enough to really have infection cycle down and go towards zero. For that, experts are saying maybe 70% or maybe 80% of people need to have antibody. We're not there yet. We may be at a point where it's going to reduce the number of infections, but we're not at that point where it really could be cycled down to zero. I'm hopeful that we will be there in that 70-80% range, and then not too many months in the future.
How many months?
Now, I would be hopeful by June, but please don't hold me to that.
Thank you, sir.
Thanks, Mitch. Next up, we have David Melandra from Philly Sports Network. David, you should be able to unmute and ask your questions.
My question is for Dr. Farley. This past weekend, fans were allowed back inside the Wells Fargo Center. As the health commissioner, how did it feel to see the fans back in the stadiums doing what they want to do?
I didn't look at pictures to see how it went. My understanding was that, people were following the guidelines. I would just say whenever a lot of people get together indoors, there is risk. And so I hope that people continue to follow the standards. They got to wear a mask, got to be very careful about everything they do, not crowd. We want people at the table to enjoy the games. We also want them to do it safely.
And my question is for Mayor Kenney. With the FEMA site ending in 8 weeks, have there been any follow-up talks with the Eagles or the Phillies doing a mass site at their stadium?
I have not personally talked to them, but I don't know whether Dr. Farley or Tumar has talked to them. They are certainly on our list as the weather gets warmer and more comfortable out. They are certainly an option for us in the not too distant future.
All right, thank you.
All right. Thank you, David. Next up, we have Annie McCormick at 6ABC. Annie, you should be able to unmute.
Hi, this question is for Dr. Farley. You talked a little bit about the software issue where people are able to forward the links. You're saying today that now that's not going to be, you're not going to be able to do that. I actually, as you were saying that, received an forwarded email of the link from somebody. And it looks like, although I haven't fully signed up because I don't want to take an appointment away from somebody, it looks like I'm being able to go pretty far along on it. So it looks like it's still actually maybe an issue. Can you give us an update of the conversations you've had with the software company and where you're at with fixing that?
Can I ask what day was offering you to be scheduled?
For today at 3:20.
So today, that problem may still be there today. It should be fixed for tomorrow and beyond.
Okay. Can you just give us a little bit more of an idea of how, I mean, I know you're not a software, technician, but I mean, of what the fix is and, just to kind of explain it a little bit more to people in case they are to receive a link like this.
So in the past, emails are sent out with a link. You click on a link and you got into your scheduling software and you could schedule. And even though we had lots of wording in those emails that said you should never forward this link, people did it. They stripped off all that wording and it was sent to people with messages that anybody can do this. The new system is that there'll be just a direct email to someone and that email somehow gets them into the scheduling software and there's no link to forward. So it can't be done. Those emails have to be sent out by the software company themselves. And there's only so many they can do per day. And so that's what we're working with. But we have been sending those out for Wednesday and beyond. And it's my understanding that we have not had any problems with those being forwarded since then.
And one of the resolutions of this is when you get one and you know you're not eligible, delete it and don't fill it out. And that would be the honest thing to do.
Okay. Well, I'm checking to see whether or not.
No, I know. I'm not talking about you personally. I'm not talking about you personally. I'm talking about in general. If you know you're not eligible, don't fill it out.
And how much do you think then this is going to help with the vaccinations moving forward as far as the amount of people that now will be eligible? How much of a discrepancy in the amount of people that were eligible that weren't getting vaccinated because of this issue? That might be a question for Dr. Farley.
I don't have an exact number on that. I mean, I think it's an important issue. We know that those links were widely shared. And we vaccinated many people who were probably medically eligible, but were not necessarily invited. And we have people working the door to try to ward off people who really were completely inappropriate. So I think we're going to be doing much better, effective Wednesday, the people being there, being the ones who were invited. But we're going to have to do additional things for those people. They may be slower at scheduling appointments, which is why we're doing the phone calling to people to get them to come to the convention center.
And last question for you too, a follow up to what Mitch had said. I know you don't like to give predictions. You said you were hoping for June, but don't hold you to it. It's a beautiful day outside right now. There's a lot of people hearing the CDC, new guidelines yesterday. What's the message for people in regards to people being really excited about the fact that we might have a pre-COVID type summer? should people hold back with that excitement? Where is your head at when it comes
I
to
think
all
it's
that?
great for people to be excited about a summer that's going to feel a lot more like a normal summer. But right now, everybody still needs to be wearing their masks. So go outside and enjoy the beautiful weather with a mask.
Thank you.
Thanks, Dr. Farley. Thanks, Annie. Next up, we have Johan Calhoun from Chalkbeat. Johan, you should be able to unmute. Johan, we're not hearing you. If you want to try to unmute again, there you go.
Okay, you can hear me now?
Yes, you're good.
Okay, great. Thank you. First two questions are for Dr. Farley. Last week you said 9,000 teachers and school staff have been vaccinated, while 20,000 others have made appointments. Are we still on course of reaching the goal of vaccinating all of Philadelphia's public school teachers and school workers possibly by April?
My understanding is that CHOP has appointments for some 19,000 people. Not quite 20,000, but it's close, and they're on track to vaccinating those folks. We know that's not everybody who was either a teacher or support staff or childcare worker. So for those who are not able to get vaccinated by CHOP, we're making other arrangements. Some of them may be vaccinated at the convention centers. Some of them were directed to there. Others are being directed to clinics. And the federal government has announced that any pharmacy that is receiving federal vaccine can now vaccinate teachers. And we've said that up to other pharmacies as well, that they should be vaccinating teachers and support staff as well. So if you put those all together, I think there's probably a very large percentage of the teachers and child care workers who want to be vaccinated will be vaccinated soon.
Okay, do you know if there were any health scares reported yesterday during the district's hybrid reopening?
Were there any health scares?
Yes.
I have not heard of any.
Okay. So the CDC said if a person is fully vaccinated, they don't have to wear a mask. But we know the situation with the schools is a delicate matter. If a teacher is fully vaccinated, should they still wear their mask at school?
Now let me clarify something you said, because what you said was not correct. CDC is saying if you're fully vaccinated and you're around people who themselves are fully vaccinated only, you don't need to wear a mask. Or if you're around one other household where the people are at low risk, then you don't need to wear a mask. In every other setting, even if you're fully vaccinated, you should still wear a mask. So absolutely, teachers who are fully vaccinated should still be wearing masks.
Got it. And I had one more question for the mayor, if I can throw it in. There's a group of teachers from the We Caucus who are complaining that schools are still unclean and dirty, despite what was reported in the agreement between the district and the PFT. Wanted to get your thoughts on that. Will the city and will the district take extra steps to address their concerns?
We're working with the district and the PFT, and we're confident that the PFT, because they've agreed to go back, are happy with the progress we've made, and we'll continue working with those organizations.
And how do you feel about yesterday's reopening?
It was good. I mean, the press kind of scared the little kindergartners, but other than that, it was their first day at school and they had cameras in their face. I don't know if they were all that thrilled about it, but they seemed like they were soldiering up pretty good. Parents were really the happiest of them all. And also teachers, as I walked down the hallway of the school, I could hear teachers talking to each other about how happy they were to see their babies back.
Excellent. Thank you.
Thank you, Johan. Next up, we have David Merle from Philly Mag. David, you should be able to unmute.
Hi, first question is for Dr. Farley. I'm wondering if you can give an update on the status quo at hospitals, because I believe a couple of weeks ago, you were making the point that you were hoping the hospitals would begin running mass clinics and that they were acquiring some vaccine surplus. Is there any, have those hospitals started running mass clinics, and do you know if they're still experiencing that kind of surplus vaccine
I would say
accumulation?
Every hospital system that I'm aware of is running mass clinics. Penn is doing some in West Philadelphia. Einstein is doing some at Enon Church. Jefferson has done some at the Convention Center. Temple is doing some in North Philadelphia. Many hospitals do still have plenty of Pfizer vaccine in their freezer. Again, because the Pfizer vaccine is the one that's harder to handle. There's only hospitals that can handle it, and we've been getting increase in doses. But they are doing that kind of community outreach that we want them to do.
The second question I had was about the new sites that the health department will be running. Do you have can you tell me how many doses will be expected to, be administered at each one of those sites? And are they similar to the first three, that there will be sort of a permanent sites, once per a certain number of times per week? Is there any more clarity on how often those are happening?
Yeah, that in general are going to be once a week, and the number of vaccines that will deliver will depend in part on how big they are and how many different vaccine tables we can run. Probably in the range of 400 to start, and then I'm hoping that once we get familiar with this, we can speed up and we get closer to 500 per day.
Got it. And so those are different, slightly different from the first three, because the first three you announced were one first shot per week and one second shot per week, whereas these will just be one per week period. Is that right?
Well, no, we're going to do second doses wherever we do first doses. So we'll give her, when we go to a new site, we'll be doing first doses, and we'll be there that week, second week, third week, and then the fourth week we'll be back for second doses. Okay,
got it. And then the last question I had was just on the pharmacy distribution process. There were a couple of reports last week about, I think at Rite Aid, something like 80 some odd % of recipients were white compared to 4% who were black. And similarly, across the city, or at Rite Aid in particular, there was about 60% of recipients were not actually from the city, and I think the city had even never directed Rite Aid to not give, check ID or whatever sort of confirmation for making sure it was city residents to get the vaccine. Can you just give some type of comment on, how you are evaluating the strategy so far about using pharmacies, and if you consider, given the sort of unequal racial recipient rate and the high percentage of non-city residents, if you think that process has kind of been a failure?
Yeah, so, what I've said before is we have three goals here. One is to get the vaccine out as quickly as possible. Second is to get it out to the people who would save the most lives by us vaccinating them. And third is to do with racial equity. So the pharmacies are good at getting vaccine out quickly. We have a lot of pharmacies that can deliver a lot of doses in a hurry. They're less good at racial equity, so that is a problem. And we've worked with pharmacies to try to have it be more available to folks, that they tend to have online systems that people can register, and it's easier for people who are more internet savvy. And so I would prefer, obviously, that they had a more diverse group that they're vaccinating. And we work with them, and certainly in the wake of the publicity, I know a number of them are going to try to work this more. For example, many of them also offer vaccines off-site, and so we're developing, see if we can make matches between organizations that want to have a off-site clinic and the pharmacy that can deliver that. But we don't think that we can just say, you don't get any more vaccine at this point, because we still do have the need to get more vaccine out to all people.
And you've said now that teachers are eligible to, initially it was anyone 75 and up at a city pharmacy. Now it's teachers as well. Is that right? Who can get vaccines there?
Correct.
Got it. Okay, thanks.
Thanks, David. Next up, we have Mike Donofrio from the Tribune. Mike, you should be able to unmute.
Can you hear me? All right.
Yep.
In terms of the city's current racial equity scorecard, what is the percentage of white residents who have received the vaccine? I noticed you mentioned a handful of racial groups, but not white residents.
It's probably somewhere in the 50 to 60% range. I can get you the number.
Yeah, if you could, please. And then in terms of the coronavirus, federal stimulus, Mayor, do you know how much the city is potentially set to receive?
We're still going through that at the moment with our finance people. I don't know if Rob DeBoe is on or not, but we get back to you. I'm not really sure how it added up.
Yeah, or could you say how much you'd be asking for? I know that the budget deficit is $450 million right now, but
at least $450 million we're asking for. So.
All right,
but it has to be. Remember, this has to be spread out over a number of years. This is a one-shot infusion, but we have a 5-year plan we have to put together.
All right.
Mike, if you want to email us for that, I know the finance department's still working on the numbers, but it will be done sort of according to a formula at the federal level. So we probably won't have that for a little while.
All right. I'll shoot you an email out nonetheless. Thanks. That's all I got.
All right. Next up, we have Natasha Brown at CBS 3. Natasha, you can unmute.
Hi. This question is for a couple questions. First, for Dr. Farley. Dr. Farley, we were hearing that some people are actually making up pre-existing conditions to try to kind of get in line or jump the line in a sense to get vaccinated. Are you hearing anything like that, or is that even a factor at this point?
It's possible, that there's no way for us to really verify if someone says I've got diabetes, whether they have it or not. We're asking people to be honest, and because we want to move quickly. And so if we try to put in systems that would require people to prove it, we would slow things down, and we'd also probably screen out a lot of people that would have difficulty coming up with the documentation.
Yeah, and one other question for you, Dr. Farley, just in terms of we're also hearing about places in other areas like Jersey, even in Delaware, that where you can get a vaccine, you can get on a list possibly to get a vaccine if they have any extras left over. You know what I'm saying? It's like, you can get on the list and possibly hope to get one that day if there are any extras. Is there something like that in place here in Philly, or?
We have developed systems for the convention center and maybe some of the other sites as well, where we have a number of community organizations that have helped us get people on a standby list. And then we can contact them at the last minute and say, okay, we think we have, and there's some no-shows. And so there's some opportunity. If people can get here in the next hour, we can vaccinate them.
Okay. And then one last question for Mayor Kenney. Mayor, we're also working on the story today with Jamal Johnson. Mayor Kenney, I'm sure you might remember him, the guy who was on the hunger strike for a while in reference to all the gun violence and how he thinks that it should be addressed in the city. Apparently, he's restarted that hunger strike. And I
heard this morning he was back off it again. So I don't know what the status is. He's not out there today. He wasn't out there yesterday. So I don't know what the current situation is. We are working on trying to address the issues that he's raised and the issues that were raised in the resolution. And hopefully he takes care of his health and eats properly and stays healthy.
Okay. Thank you all very much. That's all I have.
Natasha. Next up, we have Laura McChrystal at the Inquirer. Laura, you can go ahead and unmute.
First, Dr. Farley, can you offer any timeline for when the city might expand eligibility to people who are 65 and older? Would that be with the next group, which I guess is 1C, or could that potentially be earlier?
We have a vaccine advisory committee that's looking at a number of requests that we've had to add people to 1B, and that's something that group will consider. I can't give you an estimated time, but it's a possibility.
Okay. And for the FEMA site, you mentioned that it will essentially flip over to doing second doses. Does that mean that we should see in a couple of weeks, a significant drop off of the number of vaccines, first doses, at least, that people are getting for a few weeks?
Well, I hope that we're seeing a growth in first doses being delivered by other providers during the next 2 weeks. But they'll be switching from first doses to second doses. In terms of the total number of doses delivered, we should still see growth, but the number of people newly vaccinated by that site will drop off to probably 0 for 3 weeks.
Okay. And as far as overall, I know the city put out the plan last week on how doses arriving in the city each week you expect to increase significantly over the next many weeks and months. Is it feasible that, for the administration of the doses to be ramping up at the same pace at which doses are arriving in the city? Are you concerned about whether that's possible?
Am I concerned that we'll ramp up fast enough to where we are run out of doses? Is that what you're asking?
I guess whether the administration of the doses, getting shots into arms, can actually keep up with the pace of new doses arriving in the city.
I think the limiting factor was probably going to be how many providers we have getting shots into arms per week, rather than the number of doses arriving in the city. That's where we are now. I think it's probably where we will continue to be for the foreseeable future.
Okay, thank you.
Thanks, Laura. Next up, we have Andrew Kramer from KYW. Andrew, you should be able to unmute.
Hey, good afternoon. With thousands of appointments a day at the FEMA site, have you guys been dealing with a lot of no-shows, and what exactly has the city been doing to fill those slots?
We have been getting no-shows, 5%, 10%. And as I said earlier, we have a mechanism where we have organizations that are signing up people who are eligible and that in the area that might be willing to come at short notice. That's most of them are being taken care of that way. We've had other, communication, for example, with employers, and we hear, oh my, we have some open slots now. When you have some employees in nearby, bring them on over. There have been some people who have been showed up there who are eligible. We're told them this is not a walk-up site, and so some of those people, though, if we have doses left and no one else there, some of them have been vaccinated. I don't want anybody to think that that's that they should do that, though. We're trying these other mechanisms to fill in for the no-shows.
And we're hearing from our sources about public defenders no longer doing jury trials after a COVID-positive defendant brought into the courthouse. There's been a push from public defenders to get vaccinated. Any chance of them getting priority for vaccination since they work and frequently visit congregate care facilities?
The legal category is an essential worker category that's in 1C. And so we know that there's a push for people who want to be vaccinated, but they are in 1C, and so they're not eligible right now.
Okay, thank you.
And Tumar, did you want to add anything to what Dr. Farley shared there, or was that it?
Yeah, I think I just want to add that, although Dr. Farley is right, we are trying to work with those criminal justice partners to determine which of their employees are at the greatest risk of exposure. And then once we have that information, sort of continue conversations with the health department and those agencies and those partners as well.
Thank you, Tumar. And Andrew, was that it for you?
Yeah, that's it. Thanks a lot.
Yep, no problem. Next up, we have Jad Sleeman from WHYY. Jad, you should be able to unmute.
Hey, I got a question for Dr. Farley. I've been noticing kind of since the start of vaccine distribution, just from the city data, that younger Philadelphians have gotten a much larger share of vaccine than older. And this is in a city where there's 250,000 Philadelphians over 65, so there's no shortage of older people needing the shot. I thought this ratio would flip eventually, after like healthcare workers and hospitals took up like the initial burn of vaccine doses. But it's continued. This trend has continued where, the biggest share of people receiving vaccine are under 44, followed by under 64, and then the smallest are 65 to 74 and 75 plus. Do you guys see this as, are you guys aware of this? I'm sure you are. Do you see it as a problem? We have a pandemic that overwhelmingly kills the elderly while sparing the young. Do you feel like there needs to be something to be done about this? Do you think it'll be corrected as distribution goes on? What are your thoughts on this ratio?
A couple things. The reason for vaccinating frontline essential workers is not necessarily to protect them from having serious illness, but because these are the people who are likely to get infection and pass it on to other people. So there's a benefit to elderly people to vaccinate those folks that they may come in contact with. So there's a logic for that. Nonetheless, I am concerned that because it's harder for elderly people to get into these vaccination sites, that when we have eligibility for both elderly folks as well as frontline essential workers, that we end up vaccinating more of the essential workers. So we're trying to figure out how we can direct more of the people who are eligible based upon their age to vaccination sites. So, for example, when we have issued invitations from our vaccine interest form, a greater proportion of those invitations are coming from people who are qualifying based upon their age or medical condition than frontline essential workers.
Mm-hmm. And so is there anything on the horizon to try to, any efforts on the horizon to try to change this ratio?
We're going to continue to, I would say, preferentially invite people who are eligible based upon their age and medical condition. And we'll be doing more outreach sorts of work, mobile clinic. And we know there are people who are homebound, outreach to, I might call it senior housing. We're trying to make connections between pharmacies and those sorts of facilities. That's harder, it's slower to reach those people, but those people are very important because they're vulnerable.
And just a clarifying question, because I don't come to these. So when did the paradigm flip from limited by supply to now limited by administration? When did we kind of cross this inflection point in terms of what's the limiting factor?
I've been saying that at the press conferences. It's a few weeks ago. I can't tell you how many weeks ago.
A few weeks ago. Okay, thanks.
Thank you, Jed. Next up, we have Martin Pratt from Philly Your Black News. I also just wanted to do a final call. If there's any outlets who have not asked questions yet, please make sure to raise your hand so we can get you in. Martin, go ahead and ask your questions.
Thank you. This is first question for Dr. Farley. Dr. Farley, can you explain how these new centers will help with the flow of the vaccination throughout the city and why these 5 areas?
We know that even from individual conversations that some people are not going to come to the convention center. And people have told us that even though it's a good transit hub, people may be more comfortable in the neighborhood, they may have difficulty traveling. And so we've had requests from council members and a variety of community leaders to try to put services as close as possible to where people live. And so these expanded centers to try to cover the city as a whole. They're not the highest volume sites, but they're high enough volume that on a continuous basis we'll be able to make it so that people don't have to travel as far, and they may travel to a facility that they're more familiar with and comfortable going to.
Thank you. Next question is for the mayor or Tumar. Has there been any discussion around rental moratorium? We know that it's getting ready to expire, and so I didn't know what the city was planning on doing, or has there been discussion about that?
I believe in the stimulus there's planned rental assistance, a continued rental assistance, and we'll be rolling something out, I think, relatively soon. Tumar, do you have any more information?
I don't have any more additional information than that, Mayor, but I do know we've had teams of folks working with the court system around that moratorium. So maybe we could get you some of that detail later, Mark.
That's my questions. Thank you.
Thank you, Martin. And then our last question for today, we have Denise Clay from the Philadelphia Sunday Sun. Denise, you can go ahead and unmute.
Hello, I guess my question is for Dr. Farley. You've given, the age, criteria for vaccinations and that you have to have certain health conditions. Could you elaborate a little bit on what those health conditions are? Because I think the part of the reason why you have folks signing up for the vaccine that aren't necessarily eligible for it is because they're not 100% sure about that.
Right. So the list of medical conditions is a list identified by the Centers for Disease Control as being putting people at high risk for serious infection. And the most common conditions on that list there would be diabetes and obesity. And that also includes people with heart disease, people with HIV infection, or people who are immune compromised because of organ transplant, people with cancer treatment. So many of the conditions there are pretty uncommon, but diabetes and obesity are probably the most common.
Okay, and even with those conditions, is there a certain cutoff of age? Like, do you still have, do you get first priority if you're closer to 65 or 75 and if you're like 45 or 50?
No, there isn't any priority beyond that. It's anybody under the age of 75 who has those medical conditions.
Okay, thank you.
Thanks, Denise. So I have 3 people who have follow-up questions. I'm going to allow you guys to each get 1 question in, but we do need to make that quick since we still need to do Spanish remarks at the end. So David, if you want to ask your follow-up, then we'll go to Martin and close out with Johan. David, you can go ahead and unmute.
Yeah, my question is just about, in prior weeks, Dr. Farley, you'd mentioned that there's also a health department vaccinating, I think, about 500 healthcare workers per week, and then also like a team going out to behavioral clinics. I'm just wondering if both of those 2 sites are still happening at present.
Yes, they are.
Okay, thanks.
All right, thanks, David. Next up, we've got Martin. Martin, you can go ahead and unmute.
Thank you. Dr. Farley, you mentioned earlier that our numbers are increasing. What's the plan if we see numbers continue to increase until the end of the month on a steady, weekly, small increase? Are we going to cut back? Are we going to increase the vaccination centers? What's the plan going forward for the increase that we see not just happening in Philadelphia, but it's happening actually around the country?
Yeah, we can't, we're vaccinating people as fast as we can, and so we can't increase that to respond to that problem. I would say simply, first, we need to try to reinforce the message around masks and staying away from people through indoor gatherings. If they cases continue to rise, we'll have to look at whether we want to have additional restrictions on areas where we think that it's taking place. I would hate to do that. Many people are unhappy with those restrictions, and I understand that. And so as much as possible, we'd like to try to address that by just reminding people that they shouldn't let down their guard right now. That they should continue to have the masks and stay away from people.
Any tech solutions being considered?
I don't know of any tech solutions. I think it's still basically, the virus spreads through the air from one person to another person. So staying away from people and wearing masks is the way to prevent it.
Thank you.
Thanks, Martin. And then last question, we just have a follow-up from Johan. Johan, you can unmute.
Yes, this question is for either Mayor Kenney or for Dr. Farley. Do you know whether all school staff have received and will continue to receive health accommodations? It was said last week that everyone was offered, but there was no comment on who has received the accommodations.
I am not aware of, I could check with the district to find out what the situation is. Look, we're trying to be as cooperative with everyone, considering all the confusion and concern and stress. You know, we don't want to be punitive, and we don't want an adverse relationship with our workers in the schools or taking care of our kids. So we'll work with everyone as best we can, but I'm not aware of any specific numbers on health accommodations.